Good afternoon. First, quick update on vaccine numbers, then a little bit of an update on vaccine infrastructure. Then we'll hear from the Director General and then we'll open up for questions. So, on the numbers, as of midnight last night, we've delivered more than 750,000 doses of the Pfizer Covid-19 vaccine across New Zealand. That's an increase of 107,000 doses on this time last week. Within that, almost 500,000 people have now received their first doses. We were just shy of that last night. It's at 498,670 people, to be exact. I imagine that by now, in fact, we will have clocked that 500,000 mark, with more than 276,000 people doses receiving, signalling that they have been fully vaccinated. Overall, we're now tracking 10% ahead of the plan. That's another increase on last week. I know there's a lot of interest in groups and how we are going across all of the different groups. So I have an important message for people in groups 1 and 2 who the vaccines have been available to for the longest. If you have not heard from us, if you have not booked in for a vaccine yet, we do want to hear from you now. So those who are in groups 1 and 2, if you've not made arrangements to be vaccinated, please make sure you are getting in touch. We do want to work our way through the groups as we can, and we know we have enough vaccines to do groups 1 and 2, and we want to make sure that people are coming forward. You'll be helping yourself, your friends and your family by coming forward. And I also wanted to just give a quick word of reassurance to those who are in Group 3. So if you are living in Whanganui and you have been speaking to a relative or a friend who's in Taupo and one of you has had the vaccine and one of you hasn't, please don't panic about that. There will be a little bit of unevenness around the country. Group 3 is a big group. There's over 1 million people in Group 3 and they won't all get vaccinated at the same time. But I can reassure you that we are working our way through Group 3 and you will absolutely be hearing from us. There will be enough vaccines for everybody, but we have to make sure that we are delivering this in a sustainable way based on the supplies we are getting and our capacity to deliver. So there is a bit of balancing going on there. As I indicated yesterday, we have got extra supplies coming in, a reasonably significant number of extra supplies coming in July. This is a marathon and not a sprint, as we've repeated from time to time. You don't start a marathon with a sprint. You would potentially want to increase your speed later on in the race. So we are scaling up in a sustained and controlled manner. We are bringing on board more vaccination sites throughout the country. We will have some further vaccination events, and we'll talk more about that in due course. We're bringing more GPs and pharmacies on board, so the rollout continues to scale up. But it is a large logistical exercise. It is the biggest single undertaking that we've asked our health system to do, and it is quite complex. We're dealing with a vaccine that requires ultra-low storage, ultra-low temperature storage, and a variety of other complicating factors. It needs to be, people need to get a second dose and so on. So it is a huge undertaking. As part of our planning for that, I am pleased to announce that 17 more ultra-low temperature freezers to support the nationwide vaccination effort are now in place. They're going through their final tests. That will allow us to establish a new Christchurch distribution hub, which will be able to receive vaccines directly rather than them all coming through Auckland, and it will increase our ability to spread that load. The freezers themselves are worth around $20,000 each. They arrived in New Zealand in late May, and they are currently in the process of being accredited. 12 of those will be in Auckland, and 5 of them will be in Christchurch. That's in addition to the 7 we already have in Auckland, and the 2 further in Christchurch. That will allow us to store up to 4 million doses at any given time, which is in our view, should be enough to see us through this campaign. And the new Christchurch hub will be operational in July, which is when we expect to start receiving bigger deliveries. In closing, I want to issue a word of praise. We have said to employers that we ask them to do the right things by their staff and in terms of encouraging staff to come forward. So I want to send a particular shout out to Westpac, who have offered their staff a half day of special leave for each dose of the vaccine that they will be receiving. I want to commend them for that. I want to commend them to their colleagues in other parts of the business world and say that this is something that we would encourage where you're in a position to do that. Please do encourage your staff to come forward and to get the vaccination. I will now hand over to the Director General and then we'll open up for questions.
Thank you, Minister. Kia ora koutou katoa. So there are no new cases of COVID-19 in the community to report today. There are 2 new acute cases in managed isolation and 2 historical cases being reported today, and further details will be in today's media release. On Melbourne return green flights, these begin today, and there will be about 450 people on Air New Zealand flights arriving into Auckland at 5:30 p.m. and then at 12:20 a.m. early tomorrow morning. There will be a further 2 flights from Melbourne that will land tomorrow with around another 300 passengers. Anyone flying to New Zealand from Melbourne must do the following before being issued a boarding pass. They must have a negative pre-departure test that has been undertaken within 72 hours of travel. They have to complete the No Mai Rā travel declaration and also complete a specific declaration that they have not visited a location of interest, and there are now over 350 of those, so they will need to make sure that they haven't been at any of those. If someone does return on a green flight, they do not need to go into managed isolation when they arrive in New Zealand, and when the travel pause is lifted, full quarantine-free flights will resume. We're expecting to give advice to the Minister and Government tomorrow morning on the travel pause and what will happen with that after it expires, after the current pause expires. The Melbourne cohort, that is people who travelled back between the 20th and 25th of May who had been in Melbourne or the Greater Melbourne area, that included aircrew, the total is now 5,160. All these people have now either returned a negative test, they have either or gone back to Australia or reached the 14-day post-exposure date, or they were exempt from testing because they are under the age of 12. So there's no further action required with this group. I should say that there were around 200 people who we had contacted a number of times and who we have been unable to find a test for, and who should have had a test under the Section 70 order. And I guess the comment I would make is that we're in a very privileged position to have quarantine-free travel arrangements in place with Australia and indeed the Cooks, and we don't want to put those arrangements at risk. So when these situations do arise, it's important that people on either side of the Tasman do what is asked of them to help ensure that not only are both Australians and New Zealanders protected, but that we are able to maintain that quarantine-free travel arrangement. New Zealand border authorities did identify 3 people who left Melbourne and came to New Zealand via Sydney when they should not have been able to do so. They arrived at Auckland Airport last week. Travelling from Melbourne to Sydney at that time was in fact a breach of the lockdown restrictions in place in Victoria at that time, and there is also, as you know, currently a pause on travel from Victoria to New Zealand until at least 7:59 p.m. New Zealand time tomorrow. Those 3 people were identified when they arrived and were immediately transferred to a managed isolation facility in Auckland, where they will remain for a 14-day period. They have all had and returned negative day 0 tests, and their day 3 test results are due back today. So in preparing for quarantine-free travel with Australia, New Zealand developed strong systems, procedures and plans to manage any risks, including the implementation of the No Mai Rā contact information system to assist with contact tracing, as well as the health declaration, random temperature checks at all airports and passenger assessments if anyone has got any symptoms. And although this incident involving these 3 people appears to have resulted from disappointing actions by the 3 people concerned, our relevant agencies will, of course, continue to review our procedures and processes to make sure that if there are any improvements, we will identify and implement those. Of course, anyone who is taking advantage of quarantine-free travel with Australia or the Cooks does need to plan ahead and be prepared, have a plan in place in case there is a disruption, such as we have seen over the last 2.5 weeks with Melbourne, and to make sure that they have planned ahead for that. An update on our advice around vaccination with the Pfizer vaccine in pregnancy. Today we are publishing updated advice based on a request we made to our technical advisory group, and that recommends that pregnant people are now routinely offered COVID-19 vaccination with the Pfizer vaccine at any stage of pregnancy. This is because the technical advisors have agreed that the risk of severe outcomes from COVID-19 infection are significantly higher for pregnant people than they are for the general population. Data from a large number of pregnant people who've already been vaccinated around the world has shown that there are no additional safety concerns with COVID-19 vaccines, and specifically with the Pfizer vaccine. And interestingly, vaccinating during pregnancy may also help protect the baby, as there is evidence that infants can get antibodies to the virus through both cord blood while in utero and also breast milk during breastfeeding. And to finish, finally, I'd just like to note 2 milestones today. It's a year since New Zealand went back to Alert Level 1 after our late March-April lockdown. We moved back into Alert Level 1 at 11:59 p.m. on the 8th of June 2020, and it's just over a year since we launched the COVID-19 Tracer app, which has turned out to be an important tool in our contact tracing efforts, and it's pleasing to see we now have 2.8 million registered users, and we were on 470,000 scans reported yesterday, but I'd love to see that number go up every day. It's an important tool, and we never know when we may need that information. Thanks, Minister.
Sheena.
Do you have any more details about the person who was transferred from Jet Park to Middlemore last night for COVID reasons?
I don't have any more clinical information about that person, but what I can say is that anyone who's in either the quarantine facility, which was where all our positive cases go, or even if they're in a managed isolation facility, is treated as if they are positive for COVID when they are transferred to and managed within the hospital setting. So there are well-rehearsed processes for ensuring people are transported safely and, of course, are cared for safely. It doesn't create any risk for other people who are using that hospital facility.
Strike to the vaccine rollout today.
If I could open up on that, it'll be a relatively slow day in terms of vaccinations. Feedback we've had from DHBs around the country is that they are expecting to be anywhere from 30% of their normal capacity to 70% for, at the upper level. So that means that it won't be a big day for vaccinations. The DHBs are, of course, scaling up significantly. I don't think it will affect their overall performance, but it does mean that today will be a slow day.
Sites are closed today.
Like I said, it depends between, I don't have an exact number of sites, but anything from 30% of what their normal capacity would be up to 70%.
If this continues to strike, it's going to have a fairly significant impact, isn't it?
Look, I understand that, the parties will get back around the table after the strike. Minister Little will comment from the government on that, but certainly I would encourage them to keep talking.
+1 = 2, you're standing here saying that it is going to be a slow day. If there's any more strikes, it's going to be a lot of slow days.
Look, I don't want to speculate about potential future strike action. There's a strike today, clearly. They're out the front right now as we speak. But I just encourage people to get back around the table and talk about it.
Do you have any possible contingency plans for if there are more strike days? I mean, is there any way that you can get other people doing the vaccinations?
Look, the vaccination workforce, yes, nurses are very integral to that, and I don't want to underplay that. We have been doing more work about expanding the vaccinated workforce, including the Kaiawhina workforce and others. That work is ongoing. And we continue to make sure that we're going to have the workforce that we need as our vaccination numbers ramp up. I'd also like to see capacity in the weekends, for example, increasing. We do see numbers dropping down a bit over the weekends. It's not going to be a big setback for us, although it will be a quiet day.
Any specific contingency plans, though, in case there is strike action in the future?
Look, again, I don't want to speculate on strike action or what we might do if there was. Jane.
Back to the people in Sydney, do you have a time, or what was the time lag between them arriving and being tracked down? And also, are there any legal consequences? Obviously, they breached an Australian lockdown order, but what are the legal ramifications for them either here in Australia, if any?
So my understanding is that provided incorrect information on arrival in New Zealand, and it was our staff at the border doing what they do well that uncovered that and identified that. They were never allowed past the border, so they were held there while that process took place, and then they were transferred to MIQ because they are not part of a border exemption, so hence they have to...
Why did they be housed in New Zealand? Why weren't they put on a flight straight back to Australia?
Ultimately, they are not covered by a border exemption, which means that anyone arriving in New Zealand who is not covered by a border exemption goes into 2 weeks of managed isolation. So they have been treated exactly as they would have been if they were coming from another place where there isn't a quarantine-free travel arrangement in place, which there currently isn't. Well, there actually is now as of earlier today with Melbourne, but at the time they arrived there wasn't.
Consequences for turning up at the border and lying about where you've been and presenting a significant risk if the customs officers or immigration hadn't actually picked that up?
So there are fines, there are potential fines. Obviously I don't make the decisions about who gets fined and doesn't, but there are potential fines.
The police have shown really that unless they get direction from the Director General or the Ministry of Health under the health orders, they're quite reluctant to actually convict or push charges. So, at what point do you say this is illegal, you're breaching a health order and you're lying to officials and presenting a major risk?
Well, look, what I can say is that the most immediate consequence for them is that they've got 14 days in managed isolation, which they will have to pay for. They will have to pay the managed isolation fee. Whether there's anything further beyond that, there's partly here in New Zealand, so there'll be some decision making of those who make those decisions in New Zealand. I don't make decisions on individual cases, but there also may be consequences.
Direction from health officials. Yeah. Will the Director General of Health be giving a signal that this would be prosecutable or not?
I haven't actually looked into that. These people are in managed isolation at the moment. If they return to Victoria, then there may well be consequences for them there, because in fact the main health order that they breached was the one that was requiring everyone in Greater Melbourne area to remain at home, and so that's in fact the law that they breached. I think our officials here, colleagues here, did an excellent job at the airport to identify them. It shows that our processes are working, that they're not reliant just on a declaration, although as with many parts of our whole COVID response, we rely on people to do the right thing, and the vast majority of people do.
Are they Kiwis, or are they Kiwis trying to return home, or are they Aussies coming here on holiday?
My understanding, I don't know their citizenship status, but my understanding is that they are normally resident in Australia.
Back to that COVID case in hospital, do we have any age range or gender identity, any of that information?
No, I don't have any further information on that person.
And just going to household contacts when it comes to vaccinations and border workers, we're told it's a high trust model, but are there any concerns that people are abusing that and just listing loads of people as household contacts?
No, I mean, if you look at the numbers in Group 1B, it would suggest that there's not a lot of people coming forward in that group, and I'd certainly encourage more people, if they are living with someone who works at the border in any capacity at the border, to come forward and get their vaccinations. They have the ability to do that. It does help us to contain the risk, whilst they themselves are lower risk than the people that they're living with. They are higher risk than others, and so that's why they have been prioritised. So I absolutely would encourage them to come forward.
Confident in the checks that are in place for people who claim to be household contacts? I understand you just have to give a name and a phone number.
Ultimately, we are not going and sending inspectors around to people's homes to check whether they are living with a border worker or not. But border workers have been supplying us with a list of people who they live with, and generally speaking, that's the way we match people up.
China has just approved vaccines for children above 3 years old. The UK is looking at vaccinating children as well. Will we consider vaccinating kids?
So we do have, MedSafe have been going through the process with the 12 to 15-year-olds, which we've signalled before, and we'll have more to say about that shortly. As the research from Pfizer gets to us that indicates, efficacy and safety for lower age groups, MedSafe will consider that, and then, we follow MedSafe's guidance in terms of which age groups should have access to the vaccine.
And on the data issues that you've been having, actually tracking who's got the vaccine and who hasn't, how widespread are those data issues, the ones that people aren't being recorded properly?
In that group 1A, so that's our border workers, there can be some issues and 1B actually, there can be some issues at the margin. So for example, if somebody lives with someone who works at the border, goes and gets their vaccine because they are older, for example, they might be over 65, they may not be recorded in the 1B category, they might be recorded in the group 3 category. And so you're never going to be able to completely 100% control for that because we don't keep a database in New Zealand of who lives with whom. And so there'll always be a few issues with that. In terms of at the border, one of the issues that we've had around MIQ is that, and we're talking about at the margins, when people arrive on site, they say, I've been vaccinated. If the database is not flagging up immediately that they've been vaccinated, where that's been investigated, generally speaking, it's true, they have been vaccinated, but it just maybe hasn't been coded correctly so that it's not coming up, showing up in the right place.
So in that instance, is that, how widespread is that? Is it just in Auckland that we're seeing that? Or is
No, it is, like I said, it is at the margins. So if you look at the Border Workforce Testing Register, which now flags up whether someone's been vaccinated and whether they've had 1 or 2 doses, it's a relatively small group of people that we're talking about here.
What percentage of the vaccines that have been given have not been coded or recorded properly?
Well, it's difficult to know what you don't know, but what I can say is there are people in the Border Workforce, it's a Border Worker Testing Register, who are regarded as active but who are not currently working. So they can be people who might have once or twice gone into an MIQ, for example. They may not have gone back, so they may have had to be tested because they were there once, but they may not have an ongoing testing obligation and may not therefore need to be vaccinated. So there'll be people in that category. Like I said, it's at the margins. It means that those numbers don't always, give us a nice, neat 100%, which is what we would like to get to. But like I said, it's at the margins.
The immunisation register's up and running though, right, across the country? You have a concrete record of who has a vaccination?
Yes.
What about the other data systems? Where are they at? Because the impression given earlier was that they should be up and running by now.
So if you look at the who's on site, or who's on location, I think it is.
Vaccine rollout, not in terms of the border system.
Well, if you're looking at, say, Group 1A, in terms of how we track who's been vaccinated in Group 1A, we do use the Border Worker Testing Register for that.
The
Okay.
other 3 data systems in terms of the
Oh, right, so you're talking about the booking system,
booking
the inventory system and so on.
Yeah.
So the inventory system is being used to track and trace where our doses are, so we know where our doses are. That system is running effectively. The team who are managing distribution can tell us where our vaccines are, who's got so many sitting in their fridge at any given time. That system is working. The immunisation register is working in the sense that we have a record of everybody who has been vaccinated. The booking system has worked very successfully during its sort of piloting phase and is now in the process over the next month of being rolled out to all of the DHBs and all of the locations. As all that data is being added in, there's a bit of a process that goes behind all of that so that it's ready when we go live with a bigger rollout from July onwards.
Are all the DHBs willing to use that system? There was some indication earlier on that maybe they would retain their own systems or have their own systems that speak to that system.
Yeah, so all the DHBs will be moving on to the national booking system. We've started with the DHBs that don't have an electronic booking system at the moment, but even those larger ones, and particularly say that those in the Metro Auckland region, they will be moving on to the national booking system, and the data that is on their existing system will be migrated across to that.
Hold up there.
Oh, there's no hold up. It's actually rolling out. It's a big piece of work, and even just rolling it out to each DHB requires training of people, not just the people at the DHB and the support there, but also it needs to then be rolled out to each vaccination site as well. So that's happening DHB by DHB, and actually every DHB will be on the register, on the booking system by the end of June, and then there's a couple of weeks of just getting it all nice and tidy nationally.
I think, as the Prime Minister indicated yesterday, we will say a bit more about this next week, including a bit of a show and tell for those members of the media who want to actually see the system live and see how it operates. We'll be doing that from next week.
Your updated advice for pregnant women, some of them will be looking at this and seeing that there's a pretty much extremely low chance of them getting the virus in the community. but according to the newest MedSafe data, there's about a 1% chance that they'll have some kind of serious or severe reaction to the vaccine. And that'll be kind of a toss-up that they're looking at. Is there any risk to pregnancy from any of those reactions that MedSafe has been seeing, some of which are kind of alarming in recent weeks?
Well, I don't think they're alarming in the sense that there's nothing that we're seeing in our reporting of adverse reactions that is out of the ordinary with the experience of other countries with this vaccine. Yes, of course, everybody, and in particular pregnant people, will want to weigh up the risks and benefits for them, and I think that's important that they've got good information to do so. You're right that currently in New Zealand, because we have no COVID-19 in the community, the risk of actually getting the infection is very low, and they will want to weigh that up with, what are very small risks and of having the vaccine. But as I said earlier on, the data are confirming that there are no additional risks for people in pregnancy.
Gina.
Sorry.
We'll come to Derek and come back to you, Gina.
Do you have any update on vaccination numbers for each group and subgroup?
Yes, I can give you a quick update. I've got these numbers here. Allow me to find the correct page. Across groups 1A and group 1B, 53,000 first doses and 46,000 second doses. Across group 2, 306,000 people first dose, 211,000 second dose. I'm rounding these numbers down. And group 3, 111,000 for the first dose and just under 19,000 second doses. Group 4, 27,000, actually nearly 28,000 for the first dose and only a couple of hundred for the second dose in group 4.
That made their way here through Sydney. Have you been in touch with Australian border officials to question them as to how they got through their border in the first place?
My understanding is they drove from Melbourne to Sydney.
Out of Sydney.
I personally haven't, but our team certainly will have been.
Disappointment that this has occurred?
Ultimately, these people deliberately set out to work their way around the restrictions that are in place, and they got caught. The system picked them up. All right.
Shouldn't they have been picked up on the other side of the ditch?
Look, there are checks in place right the way through, but if people set out to deliberately try and, thwart the checks, they will get caught. All right. Thanks, everybody.